And as I was reading through some of that content, what came to mind for me is sort of how you show up at the doctor's office with a fever, like you're running the temperature, and the first thing the doctor does is to say, let's bring the temperature down. He says, let's bring it down because you don't want the body, the system, to spiral out of control, right? Because once things kind of go beyond certain breaking points, then it becomes a bigger issue to manage. However, that does not solve the problem that of whatever necessitated the fever. Hence, the doctor starts to do, diagnosis. What have you been up to? Where have you been? Who have you spoken to? Who did you interact with? Does a couple of tests to make sure that he's able, or he or she is able to address the root cause of whatever is causing the issue that you're dealing with. Because that's when really you can say maybe treat the bacteria infection, say with an antibiotics, and then the fever comes down. Otherwise, what you're going to continue to do is to continue to treat the symptoms of the fever by lowering your temperature, and ultimately that does not solve the problem by actually result into something bigger. This is why those who sell those medications will tell you, if the symptoms don't go away after X number of days, consult your doctor. Which brings me to the topic of this whole point around system thinking and leverage. Often we have this issue that we're dealing with that seems to be showing up in multiple places, or just seems too hard a nut to crack. And while we've mastered the art of solving the symptoms, we're probably making the issue worse because we're not addressing the root cause. Similar to the analogy that I just described by the doctor. And so the weakest point, or the least effective way in a system, is to look at those variables that you can tweak here and there, the quick system issues, organizational type stuff. Let's solve this problem by maybe giving this incentive, and then hopefully it goes away. Now, if you're not careful, you make the matter worse. It gets better in the interim and only continues to get worse in the future, which is why system thinking is important for leverage, because it tells you for leverage, because it helps you identify where's the most effective place. What's the bacteria thing we're treating here? Where should I be using an antibiotics, or should I be using something else? Should this person be going for some immediate surgery just because this is probably a symptom of something else? But then you need to know what exactly you're dealing with. Now, as you go down the scale of the items that Daniela identifies as leverage, how you can increase your leverage in the system. One of the points that, caught my attention was the fact that, the constraint